Hi everyone, welcome. My name is Claire. I'm the events coordinator here at Alertus. I'll be your moderator for today. In this webinar, Cameron Cloonan, a sales executive, will discuss the connection between rising violence, staff burnout, and turnover rates with actionable strategies for reducing security threats. Our session today will be from 1 to 2 p.m. We'll begin with an in-depth presentation from Cameron and then have the opportunity to engage with Cameron to go over any questions you may have. This webinar is being recorded and will be shared with you after today's session. All right, Cameron, take it away.
Awesome. Thank you for the introduction, and I appreciate everybody joining here live, as well as those folks who are taking time out of their day to watch the recording. As mentioned, my name's Cameron Cloonan. I'm a sales executive here at Alertus on the healthcare team. So today, the goal of the call is to talk about stopping the exit and how safer healthcare facilities can help support retention. So thank you. Quick agenda for this call. First, give a quick Alertus overview for those not familiar, and for those are, it's always a nice refresher. From there, we'll go over trends and events. We'll dive into the cost of violence in healthcare, and then finally highlight some different ways that Alertus can help, and then open up the questions. So, a little bit about Alertus. We were founded back in 2002, almost 25 years ago, when our president and CEO was a student at University of Maryland. Tragically, a tornado came through and took the lives of two students, and there was very little communication before, during, or after about the emergency. So that's where Jason had his aha moment that something needed to be done and communication needed to be better. From there, we protect millions of people every day. We have over 100 different integrations and close to 3,000 customers. And when we look at our customers and those that we serve, we are honored and grateful for each and every one of them. But a key takeaway from this slide, if anything, right, what Novant Health does is going to be different than what NASA does, which will be different than what FedEx does. But what we do is take a holistic approach to understand your current situation, any gaps, and then tailor make a solution to meet your needs. And then as far as the challenges we solve, right? When people come to us, there's normally that North Star. Maybe it's they're trying to fix their roof while the sun's still shining. Maybe they're fixing it while it's raining, right? But usually there's that trigger event. But on top of that, we can help with a lot more, whether it be loud environments, ADA compliance. Often overlooked is reaching visitors and contractors. Healthcare, especially cell phones, are a hot topic, right? Especially with HIPAA, we don't necessarily want our nurses with their cell phones. They should be providing care for patients. Multiple systems to activate, multiple buildings and locations, as well as large facilities and time to activate. So I think it's important, right, to take a moment to think about, again, whether you're a customer or a prospect, the challenge that you face, and be honest, because you're not alone. And over the next 30 minutes or so, I'll demonstrate how we can help fill in some of those gaps. But one problem that just about everybody faces in healthcare is workplace violence, right? It's extremely prevalent. In fact, 85% of healthcare workers have faced some form of violence. The Bureau of Labor Statistics found that 73% of all non-fatal workplace injuries are due to violence, and healthcare workers are four times more likely to suffer serious injuries compared to other workers. So, you guys aren't alone in what you're probably experiencing in your facility, but it is an extremely prevalent and also important subject. And that is leading to rapid attrition and turnover, right? In the last couple years, between COVID, nursing shortages, et cetera, almost 140,000 nurses have left the field, and another 40% indicate intent to leave in the next couple years. So that's massive, right? And one of the primary factors is workplace violence. I'm sure you see it, you know, in the news, on TV, etc. But it's causing about 40% of healthcare professionals to consider quitting over personal safety. And in another poll of about 1,000 healthcare workers, 45% of them said that they're likely to quit within the next year or so due to safety concerns. So it's definitely leading to a lot of turnover. And whether you're in HR, IT, safety, everybody knows that healthcare, especially, that staffing shortages has hit the sector extremely hard. And then when we look at that cost of turnover, right? Um, on average, the cost of turnover, the annual losses in healthcare are over $18 billion. And about 80% of that cost comes from post-incident care and recovery. Additionally, when we look at the actual cost of people leaving, on average for a hospital, it's about a couple $1 million a year. And the average cost to replace just one RN is over $50,000. So, I mean, there's hard costs, there's soft costs, there's sunk costs. I mean, this one certainly does stack up. And I think worth noting for those that are interested in Alertus and aren't current customers, for the average kind of small to medium sized hospital, you can get a pretty darn good system for about half the cost of that $56,000. And with these numbers, with these stats, it's not napkin math from our marketing intern. It's from a NSI study of prominent healthcare providers in the US, some of which are clients, some of which might even be on this call today. But this is coming directly from them. It's not something that we put together. But again, when we talk about that cost of turnover, right? For a CNA on the high end, it's up to $6,000. For a nurse practitioner, up to 115,000. And then for a nursing manager, just shy of $250,000. Now, I'm not suggesting you go running down to your CFO's office and tell him, hey, if we implement some Alertus stuff, we're going to save $250,000 a year. I'm not saying that. But the reality is, workplace violence is causing turnover, and nurses want change, and we can help. So when we talk about change, right, and a call for action, in another study of healthcare providers, 77% of them said that their organization has increased security in the past year. 61% of doctors' offices say they lack panic buttons. 82% of people are begging for enhanced measures, and about half of them said implementing panic buttons at work would make them feel safer. So, not everyone's ready to throw in the towel, but a lot of them are wanting a little bit more. So, just to kind of summarize, right, about 80% of workers have reported or witnessed aggressive behaviors. 40% are considering quitting their job due to safety concerns. About 82% of workers have indicated that they want their employer to enhance safety measures. So, just about all of them. The average cost for turnover from these statistics for an RN alone is about $56,000. And about half of the employees say that putting in panic buttons would make them feel safer. Um, so the data's there and it's backed up across many, many studies. And just outside of the economics, right? Looking past that $56,000 it costs to fill that seat of an RN, when you look at continuity of care, right? Maintaining census, staffing shortages, even managing contingent labor. I'm sure most places have some sort of per diem pool. That $2 shift differential, 24 bucks on a 12-hour shift, isn't going to mean much if they feel much safer across the street. So it really this subject is pretty widespread across more than just even what we're talking about right now. But everyone deserves a workplace where they feel safe and at least have adequate protection, and that's where Alertus can help. So before I hop into the panic buttons, which as mentioned, about half of the folks are asking for, I think it's important to take a quick glimpse into how Alertus looks at our projects and what our difference is. So whether you're interested in picking up some more products or vetting out different vendors, I hope you take away our philosophy on these projects. First things first, we look to integrate with your existing assets. So you've probably spent a lot of money on computer monitors, phones, overhead systems, etc. How can we tap in and leverage that existing investment in infrastructure for greater reach? From there, we fill in the gaps. Nobody is going to have perfect coverage, but whether it's reviewing your floor plans, doing a site walk, or just having a candid talk and doing some reflection on those places we know people aren't getting alerts, we have different pieces of technology that can help ensure that those aren't dead zones for safety. And then finally, we tie it all together with a single point of activation to simplify getting that message out. So when we look at our panic buttons, we have quite a few different ones, but here's just kind of an overview of them. I'll dive in deeper to each one. We have IP ones, so on the computer. We have mobile ones on the phone. We have Wi-Fi panic buttons, which are extremely popular, and then we also have USB panic buttons. So one of my favorites is going to be the desktop activator. So that is going to be a IP-based panic button that's actually on their computer. So in a matter of a click or two, they're able to fill out forms, which you can see on the bottom left, such as name, room number, etc. And they can do that throughout the day. And then right here, you'll see they're able to actually activate right from a one or two clicks for the computer. Now, that activation could be uh, a, a site-wide shutdown, or it could be notifying maybe security and administration of the concern. So, worth mentioning, everything Alertus does pretty much is on a if-then logic. So, if this button is pressed, then these things go off. If Cameron activates his panic button, then the staff members are aware. So if something I cover seems interesting, but maybe the example isn't quite the use case that you were hoping for, just think of that if then logic, if and then we can likely do it. But we can also tie panic buttons into these. So these are our banker buttons. What's great with these, super discreet. Blue means they're on, red means they're activated. So giving just a little bit of feedback. Hey, help is on the way. The alert was activated. Additionally, these are extremely popular. These are going to be our Wi-Fi panic buttons. So you can designate them for individuals, for wings, even for certain rooms, right? Maybe it's therapy room one, two, and three. But in the event that someone presses the panic button, it's going to ping to the nearest Wi-Fi access point and letting you know the approximate location of where it needs help. And then if you register to a person, a room, etc., who set it off. Common questions we ask or get about these. How long is battery? On average, about 2 months. And then the other question is if battery is low, do we get told? Yes. We send out there's an automated email, and then you can also see it in the system. Another great feature is it actually checks in with the alerted system. So you can set up a cadence, but let's just say it hasn't checked in with, let's say Cameron's Wi-Fi panic button hasn't checked in within 2 days, right? You can actually, as an administrator, get an alert that it hasn't checked in, and then you could reach out to me, say, "Hey, we noticed your panic button hasn't checked in with the system. Are you bringing it to work? Is it dead, etc." Because any piece of technology is no good if they can't use it. Additionally, we have the multi-USB panic button. These are extremely popular at nursing stations. What's fantastic about these, the Wi-Fi panic button is awesome for that person running around, you know, where to send help and who to look for. With these, it's more stationary. It's going to plug into a computer, but it lets you know the actual type for more granularity. So we have active threat, intruder, violent threat, system outage, disruptive individual, assistance required, medical emergency, and all clear. So the response for an active threat versus a medical emergency is going to be quite different. But through this panic button, your responders are going to have additional information to ensure the right people are showing up to help. This is one of our newer products, which we are extremely excited about. For those clients of ours on Alertus, this is part of Alert Aware, which is going to be our mobile alerting. But this is our personal duress badge. So it ties in with Alert Aware via Bluetooth. You can actually there's a little slot to put like your work badge in. But if somebody activates this through the button, then it will ping their approximate location through their phone and let other staff members know that help has been requested. The two most common ways we see this being used is either A, on a cadence. So, hey, check in every 45 minutes or check in every stop you make. And then when you leave, check in again by pressing the button to close that loop. Or they're not checking in at all. But if they do activate, then that will ping it. So a couple different use cases and there's more beyond that, but those are our two most common. So for those folks, maybe doing home health, hospice, maybe going out in the community, boots on the ground. It's another way to keep them safe and for also you guys to know what's going on with them. So we're extremely excited about this. For those of you not familiar with Alert Aware, that is, as mentioned, our mobile alerting. So through this, we can do push notifications, text, call, email, um, and you can also give your employees access to it, right? See something, say something, help expand the reach of your team. We have other organizations, for instance, we have one in Australia that uses Alert Aware. If there are snakes, right? Australia has a ton of beauty, but also some pretty gnarly creatures out there. So if they see snakes, they will take pictures and send it, and then a snake expert will, I guess, let them know if someone can keep it as a pet or stay away because it's poisonous. So just there's so many different ways that you guys can leverage this technology. And then one step further from the mobile app suite, we also have the Activator app. So those of you who are in like security, IT, administration, etc., right from your phone, you can actually set off different alerts on the right here. All customizable for you, but no longer do you need to be behind your actual computer or behind the button. So really just kind of modernizing how you're able to communicate those different alert types to your staff. So, in addition to panic buttons, we have some other ways that we fill in the gaps, looking back to our philosophy on projects. As you can see, we have a ton, right? We have visual, so we have strobes, great for like operating rooms, etc. Places where we don't want to make too much noise but need to grab attention. And then we have a variety of audible ones, the omnidirectional speakers, indoor, outdoor horns, right? Maybe it's for a parking garage or for some of these larger campuses, making sure that if someone's going building from building, they're still in the know. If you have an existing PA system, there's a strong likelihood that we're able to integrate with it through our text to speech integration. If you're a current customer and that sounds interesting, basically you press an alert, it can also enunciate over your overhead system. With that being said, we always quadruple check compatibility, reach out to your sales rep, let them know you learned about it, and they will send you a questionnaire. But two other common and really popular devices for filling in the gaps is our alert beacon, our flagship product, as well as the indoor text to speech speakers. So, Alert Beacon, if you're not familiar, is going to be our flagship product. So, it provides strobes, sound, as well as a message. So, an evacuation order, etc. It's also a smart device. So, it can hook up to sensors and other pieces. So, maybe if a temperature in fridge gets too low, it can alert you. If you have flooding in a basement, it can alert you, etc. So pretty useful, pretty versatile, super popular in high foot traffic areas or maybe like in a maintenance room, etc., where they're not in front of computers all day. But that beep, it's up to 106 decibels, will actually kind of cut through the monotony and grab people's attention. Additionally, we have the IP text-to-speech speakers, which are perfect for areas where your overhead system does not reach, um, or maybe additions or new places where that intercom isn't currently there. So about as close to plug and play as you can get. PoE will enunciate across the room or area for you. And then when it comes to integrating with existing infrastructure, right? Again, anything you see on here, we can likely integrate with, whether it be VoIP phones, personal devices, digital signage, fire alarm, etc. But kind of the workhorse of this would be the desktop notification. So completely customizable. It's a great way to push out messaging and use all the computers you already have as an additional endpoint. Furthermore, you can do full screen, partial screen, as well as ticker. So whatever kind of messaging you have and need to get out, you can decide what it is, and it will push it out for you over the laptops. It can also take over speakers if they have them, which is just great to be an additional layer on top of your current intercom systems. Awesome. And then, right, we talked about how we look to fill in the gaps, integrate with existing assets, and then tie it all together with a single point of activation. These are all the different ways that you can get this messaging out, right? From a full system activation, you can log into your computer or phone and use the Alertus console. Additionally, from a fire alarm, we can actually have that trigger alerts. You can use desk phones, a variety of different panic buttons, as well as your app or a tablet. Additionally, for internal communication, I mentioned the different panic buttons as well as apps. So there's a ton of different ways that people are able to get messaging out. And then when we do look at response times, right? Because it's this stuff's no good if it's not getting to the right people quickly. This is a case study we did at California State University, San Marcos. So when they activated their system, on average, for their alert beacons to go off, it took 11 seconds. For their desktops to go off, it took 12. Digital signage was 13. So it's extremely quick. And that was just based off their configuration of a 20-second cycle. We can even tighten that up a little bit, but 20 seconds is usually ample for most folks. Um, so yeah, in summary, again, workplace violence is continuing to skyrocket. It's leading to turnover, which is extremely costly, and nurses are asking for change. They're asking for more resources, and Alertus is there to help. So that is the conclusion of my slides. I will now open it up to any questions that people may have.
Thanks, Cameron. We can get into the Q&A portion of this session. Please submit any questions and comments that you may have in the chat. We have received a few questions already. The first one is, the organization I work for has multiple locations and care settings. Do I need to get a separate alert system for each one?
So a great question, thank you. So the beautiful thing about Alertus is it's extremely scalable and customizable. So unless you have some pretty unique network configurations, you'll be able to use a single Alertus system, and then we can configure each site to kind of fine tune it for their needs.
The next question is, what do most new customers start off with?
Yeah, that's another great question. So most customers that start off, they're going to obviously pick up the Alertus system. From there, the desktop takeovers are extremely prevalent. It's a very powerful, very cost-effective tool to ensure that you're essentially billboarding any sort of emergency message you may have across everybody's computer or the computers that you choose. From there, generally people are gonna fill in with maybe some panic buttons, but we're an extremely scalable solution, and it's always important to not, you know, bite more than you can chew. So depending on your unique situation, your circumstances, and also the bandwidth of your teams, we're able to make recommendations of, what is enough, and sometimes pull back if people are a little too excited and want to do too much too quickly.
All right, well, I think that concludes the Q&A section of this webinar. Thanks again, Cameron, and thanks for everyone joining us today. If you guys have questions or need any additional information, please feel free to email us at events@alertus.com and we'll be happy to assist you. Thanks, everyone. Have a good day.
Thank you.